My name is Sarah Wedge, and I'm going to be paying a Minibag. So first you have to check the doctor's order to make sure it's the correct dose, route, and frequency. We are going to be giving Verseptin, which is an antibiotic. It binds to bacterial wall membrane, causing cell death, and it's used for infection. The safe dose is 2 grams every 12 hours, and it matches the doctor's order, so it is a safe dose. The side effects are seizures, diarrhea, and contraindications are hypersensitivity to penicillins, cephalosporins, and a history of GI disease. Interventions would be watch for superinfection and watch for phlebitis at the injection site. The infusion time will be over 30 minutes, and here's my equation. 2 grams every 12 hours. 1 gram equals 5 milliliters, so 10 milliliters equals 2 grams, added to 60 milliliters over 30 minutes equals 120 milliliters over 60 minutes.
There you go.
Alright, so before you give the medication, you have to check the patient's labs and make sure that they're within normal limits for this medication. And you have to check and make sure that if they have any allergies. So I'm going to use aseptic technique to draw Verseptin. I have to wipe the port, and then insert my Verseptin. Alright, and then I'm going to label my bag. Alright, so now I'm going to spike the bag and label the tubing as well. And I'm going to make sure that my line is clamped. Alright, and squeeze the drip chamber. Alright, and then I'm going to fill my syringe with 6 milliliters of normal saline. So now I'm going to go into the patient's room, do my hand hygiene, and I need to ask my patient their name and date of birth and ask if they have any allergies. And I have to let them know that they're getting Verseptin, which is an antibiotic. So, oops, I have to hang it. And I want to check the IV site on the patient, make sure there's no phlebitis or infection or any signs of inflammation. Alright, so I'm going to take a new clean one, clean the ports. Alright, and this is my normal saline. I'm going to aspirate for a blood return, and we are good. I see a blood return, and so I'm going to flush with 3 milliliters and make sure that it is clamped. Alright, so now I'm going to put the patient to the bag and set the flow rate. Alright, and perform my hand hygiene. Alright, so when the infusion is complete, periodically watch for phlebitis and infiltration. Heparin is only administered if it's ordered. So then you have to attach the alligator clamp and flush with the push-stop method. Administer heparin if ordered. Dispose in containers, all your supplies in the appropriate containers. I would document the time, drug, the dose, the route, the condition of the IV site, the volume of the fluid used to deliver the med into the